We are back on MorningLine on this Thursday. Thanks for joining us. We're talking with two certified navigators for Get Covered Tennessee, talking about Affordable Care Act enrollment. If you're getting that type of insurance, and there's some 200,000 of you here in the state of Tennessee, Mary Moore and Emily Fauché can answer those questions for you. 737-7587. A couple of things, you know, as the calls can come in, and I know a lot of folks maybe just listening, digesting this, deciding what. There have been people that you said in the past perhaps you know, didn't find something that worked for them. If that happened and it didn't work, hey, try again now, right?
Exactly. So every year there's new plans on the marketplace. Every year there's changes, and then the person's situation may have changed too. Right. So we always encourage people, even if they went out the first year and tried to find a plan, or they went out last year and tried to find a plan, to please call us back. We can tell them what's available this year. Like we mentioned before, there's no pressure. We're unbiased. If people decide not to enroll, that's fine. So they really have nothing to lose by looking into their options again. I'm
curious, if someone's listening then, when you look for an option on a plan, all right, let's just say I decide to do this. If I'm in a situation to apply for it, I would call and get you on the horn, and I would say, look, I'm looking for plans. I'm not on there right now, and your question to me would be, what are you looking for in a plan? I mean, would I need to share some of my medical history with you?
That's completely up to
if I want, well, why wouldn't you? If you don't, then how the heck do you figure out what? So I'm going to look, I have high cholesterol, sometimes need to have blood tests a couple times a year, may have to pay for a statin drug if it goes up too high. Beyond that, I basically just deal with, you know, strep throat a couple times a year maybe. Yeah, I might injure myself doing some athletic activity, but beyond that, I'm a relatively healthy individual. And I just want basic physicals and preventative care. So what would you say?
So it definitely helps when people share some of their healthcare needs, because then we can help them compare the plans in more detail. Of course, it's not necessary. You wouldn't have to share any information you're not comfortable with.
If you don't share, now you could go look on yourself, but if you're calling you, I can't imagine, why would someone call you and not share some of their plan?
Well, we would be able to say, you know, with a specialist visit, it would cost you this much on this plan, that much on this plan. Your medications might cost you this much on this plan, that much on this plan. We can speak generally, of course.
So let's be real clear then. You don't have to tell them your medical history. I would, because I want to get as specific as I can. But go ahead.
Most people do. You know, once we get down to that point
and
of
everything's
the conversation.
Confidential?
Yes, of course.
Oh, I'm sorry. So
no, it's okay. Once we get to that point of the conversation, then you know, most people do discuss, okay, I want to make sure my doctor's in network. That's a really big one, is if someone has a physician that they're really comfortable with, or a specialist that they can only see at a certain hospital, they really want to make sure that hospital or that doctor's office is in network. So that's a really a crucial point for a lot of people. They might pick one plan over another just because their doctor accepts one plan and not the other.
That's a great point. So certain plans have certain doctors, and so you may find a plan that's like, wow, this is more closely suited to the condition I have, but I would lose my doctor. So you have to make the choice. Is it worth keeping my physician, you know, and maybe sacrificing some of a closely, you know, more closely matched plan to stay with my doctor, right? Is that, it doesn't always match up.
Right.
You have to choose whichever you prefer.
And that's exactly what people, you know, people have to decide and choose. Sometimes it's easy. One plan covers everything that they need. Sometimes it's, you know, you have to balance your needs and your priorities in order to figure out. And that's what we're there for. We're there to help you figure out, you know, we're not going to tell you, oh, this is the most important, but we're there to help you decide, okay, your doctors are in network here, but this one's going to cost you less to see your specialist, you know, and we can help you make all those comparisons, and then with all that information, you'll make a better informed decision.
Are we seeing more or less doctors, you know, participating in this and these plans? I mean, in terms of the variety and number, do all doctors have to accept this? If they're not in it, can there be a doctor saying, look, I don't want to have anything to do with Affordable Care Act patients? Does that happen?
So each plan is different.
Okay.
Doctors don't have to accept it, so it's up to them what insurance companies they accept.
Can you tell me why they wouldn't accept it?
Well, it just comes down to reimbursement rates, like with any insurance. So one doctor might take, Blue Cross Blue Shield is one of the carriers, for example. So one doctor might accept Blue Cross Blue Shield's reimbursement rates, but they don't accept Cigna's. Cigna is another company on the marketplace. So just like with anything else. Now, one thing I do encourage people people to do is when they call their doctor's office to make sure that they're going to be in network with their plan, is to not say, I'm getting marketplace insurance or I'm getting Obamacare, because sometimes there's a miscommunication. What they need to do is ask about the specific insurance company that they're choosing. So instead of calling up and saying, I'm going to get Obamacare, do you accept that? They should say, I'm looking at signing up for this Cigna Connect plan.
Gotcha.
Are you in network with Cigna Connect?
Okay.
Or are you in network with Bright Health? Because that way there's no confusion, because Obamacare or the marketplace, there's multiple companies on.
I think that's great advice.
Yeah. So,
and those are the two. Can you name the other names? What are the 5 now that are
there's Cigna, Blue Cross Blue Shield. Bright Health is one of the new companies. They're offering plans in the Nashville area, Knoxville area, and Memphis, right? And Memphis. So they're new in the 3 metro.
It's not necessarily all statewide. Okay.
Yeah. So each region is different. There's 8 insurance regions in Tennessee.
I see. Okay.
Ambetter is another one of the new companies, and they're offering plans in Chattanooga and Memphis. Right, yeah. And then we have Oscar. They were a new carrier last year. So Bright, Cigna, Oscar, Blue Cross, and Ambetter. Those are the 5 companies.
Let's take a phone call or two. When folks get in, I want to get them in as quickly as we can. And if, like I said, it can be complicated. Look at all the silly questions I'm asking, but I mean, I'm learning here, and you can too, because to find the best plan for yourself. Let's go to Thomas. Hi, Thomas.
Hello.
How can we help you, sir?
Hey, listen, I went on to the marketplace and updated my financial stuff about 3 or 4 days ago. And I just wanted to check and see what my options were, you know, if I wanted to end up changing my plan that I had from last year. My kids, because of my income level, my kids got transferred over, and we had to apply through the CHIP program for them. But I have an adult son that is that's living. He's 19 years old now, and he is still actually in high school. And so it was kind of acting funny about the things I put in. You know, it's just treating him like an adult, which is fine. I mean, I just answered all the questions truthfully, but I was a little confused about what type of plan I should pick.
Okay. You have some questions for him or some guidance? I know on the phone maybe it's hard, but give him some advice on that. That's
and then I guess just how long. It said that I had to like January something now that I updated my financial stuff, but I guess that's just that they're going to roll me over on the same plan.
You may be in an area.
I was trying to figure out if I needed to, when my deadline to pick a new carrier maybe inside of the plan was going to be.
Was that during this open enrollment? It's only till December 15th?
So for most people, December 15th is the deadline, but it could be possible that when you went in and changed your financial information, you triggered what's called a special enrollment period. And if you triggered a special enrollment period, then you may have an extended deadline to pick a plan.
Okay.
So I know that's a little
let me ask him. So where do you live, by the way, Thomas? Are you in the metro area? Are you there, Tom?
I am.
Oh, okay. So we were just trying to think. So I guess I'm trying to get a handle on your question then. So what exactly do you need? What is it? What question can we answer for you specifically?
Well, with my son turning 19 and him kind of becoming more of an adult, do I just need to get on and pick a plan that was similar to what me and my wife were having to pick last year?
If
Since the other 2 kids are going to roll over to CHIP because of our income, I was just wondering, you know, how I'm supposed to treat my adult son that's still living at home and going to high school.
Yeah.
Gotcha.
So if he's 19 and he's living at home, he's a student, and you're still claiming him as a dependent on your taxes, he should be able to still be on the same plan with you and your wife. Sometimes when we have an adult child, it will split you up and make you choose one plan for the adult child and another plan for the parents. But that's usually if it's an older adult dependent. I think at 19, he should still be able to be on the same plan.
And even if it does separate you into different groups, you can still choose the same plan. option. Or if you'd like to be on separate plan, sometimes people, it might be 2 or 3 people in the household that have very different medical needs, and they'd like to choose 2 different plans, you can do that.
Okay, so he's got options, but you're thinking then, I hope, Thomas, does that help? It sounds like at 19, he should be able to stay status quo.
Okay, and then one thing is that my child is actually disabled, but he's not disabled to the point where he has to have daily medical care. And it's something that we've never pushed. We've always just kind of footed the bill, and we just have an entrepreneurial mindset and all that. But him becoming an adult, that may change, but I guess that's something I'd have to take up with another organization within the government, but that might end up affecting his insurance too. I just don't know.
As an adult, so you could help him apply through Social Security for disability, and there's different types, and one of them is SSI, and that would come with TennCare. But yeah, now that he's an adult, that would be his only way to get onto TennCare. Would be to apply to pursue the disability, and if those changes come up later in the year, you can always change that. So you can go ahead and put him on your marketplace plan now, and while you're pursuing other options, and then change it when it comes about. So I know it's hard over the phone, so definitely you can give us a call and we can talk in more detail over the phone and get into some specifics on the plans you're looking at. But yeah, if it's giving you a different enrollment deadline, it probably is because you went in and changed some information, which triggers a special enrollment period.
Okay, but that means it may give him an extension, is what you're saying, beyond the December 15th deadline. Yeah, it sounds to me, Tom, if you get a chance, call one of the certified navigators. He may have done it in the past. We'll have the phone number up for you at the end of the program where you can call specifically and get through. And how many are there of you across the state? Must be dozens, huh?
There's a lot fewer this year.
Fewer? Oh, so you guys are busy.
So yeah, so we've experienced some funding cuts. So there are fewer navigators this year.
Okay,
but we can't help. It's a really good question, Thomas. I'm glad you called in because people often have questions about their adult children that are living with them.
Yep.
So.
Okay, good. Let's take a break on that. When we come back, more phone calls and see if we can help more folks right after this. Stay with us. What's Chip's?